Three, two, one. All right, and welcome everybody, and good morning. Welcome to your Healthy Self podcast. This is your host of the day, Cade Archibald, and really excited to be with you. Hopefully, you guys can hear the blender next to me. I'm right. If it sounds weird, that is our acupuncturist, Dr. Justin Lane. He's making his green smoothie for the morning. So sorry for the noise. It just started at the perfect time. So today's topic, we got some really cool stuff we're going to be diving into. We got an amazing provider practitioner here with us, and really excited to just dive in here. Before we start there, I want to cover a couple things. So we had our Hack Our Health Accelerator challenge last night. That's every Wednesday, Wellness Wednesday, 4:30 to about 5:15 Mountain Time. That is our Health Accelerator course, where we're really diving in on different things. This session is longevity, so really extending your matching health span with lifespan. So it's a beautiful course. So if you guys aren't registered for that, make sure you hop on to acueastwest.com/hack. That's HAC. That is an awesome community to be a part of. So be a part of it. And then our sponsor of the show, this as same as last week, is The Smart Medicine. For all your supplement nutrition needs, go to thesmartmedicine.com. My favorite, Intergenius Stem Boost, some great things. Intergenius, great nootropic for brain health and brain function. Stem Boost is my go-to protein blend with some really good mushrooms for immune system health and some anti-inflammatory effects. So some really good stuff. So check it out. Go to thesmartmedicine.com. All right, so today's show, really excited to have Dr. Arwen Podesta. She's got an amazing background, board certified adult psychiatrist with subspecializations in addiction medicine, forensic psychiatry, and integrative and holistic medicine. So, like, this is right up our alley. Dr. Podesta, really excited to have you on the show. She's also got a background in biochemistry, complementary medicine, and massage therapy. I think like your background's really super intriguing, and you've really merged the intellectual and vocational interest, and then became a medical doctor. Graduated from USC and Keck School of Medicine, and then moved to New Orleans for psychiatry residence at Louisiana State. Wow, there's some big words there.
You need that green smoothie right now, huh?
I do. It's about time. I haven't taken my Intergenius this morning.
There you go.
So your bio's really intriguing, really impressive. Got an array of training, and I love how you have the multidisciplinary approach. I was on your website a little bit and saw, really that, and it looks like just another piece I'll add into kind of her introduction is, so she puts programs together, main focus on holistic mental health, addiction treatment, and rational prescribing practices. And so love how you have that fusion of holistic medicine along with some of the Western medicine. And so she also has a book. Hooked is the title of the book. Just came out on Amazon. It sounds like we're gonna post that into the chat box so you guys can take a look at that. It's a wonderful book on just looking at addiction and integrative substance use treatments. Touches on neurobiology and other underlying causes, behaviors, and treatments. And so Welcome to the show, Dr. Podesta.
Thank you. Glad to be here. I love this. I do want to mention my background. It was interesting kind of coming from a holistic treatment setting, body work. I was 20 before I even started college, and I went to massage school in California, and it really opened my eyes to the whole mind, body, spirit, mind, body medicine. And I worked very closely and still am friends with some folks that were my clients back then, people that had some very chronic physical and mental health diseases. And so I became really enthusiastic about being almost a health coach. And then going to nutritionists with them, going to their doctor's appointments with them, and trying to help more larger than just massage the physical part. And so, and I've, felt like those life-changing events led me into my pursuit of medicine. I love genetics too. And so that I was working on the Human Genome Project after my undergraduate in biochemistry. And so trying to figure out like what would satisfy that longing and that satisfaction of providing that full body mental, physical, and macro environment treatment to people, plus thinking about genetics and biochemistry and epigenetics and all of the things that really intellectually stimulate me. So here I am. I did it. And that's what I think about and do every day at this point with individual patients and with teaching.
Love it. Well, and we have Reagan here with us. So for those of you that aren't on the webinar format, we also have Reagan Archibald. I'm going to kind of pass the baton to you, Reagan. So you're going to just ask a lot more intelligent questions than I am.
I don't know about that. Yeah, but I am excited, and I appreciate you being on here, Dr. Podesta, because I've worked with a lot of addicts over the course of my career. I had a neurologist that I worked with, and she ran a Suboxone clinic out of her practice, and it was devastating to see what these humans had put themselves through. Usually, it was from properly written prescriptions that got out of control, and then the patients became abused. But what do you see is at the root of addiction?
Well, I think it's threefold. First, it's, and in fact, this is kind of how I like to break it down, as simple as anybody can make it. The biology of the brain, and that biology is affected by genetics particularly. So there's a handful of genes that make people very susceptible, and that's why you see it run through families. But then stress. Stress is such a cause of many lifestyle issues and many feelings and mental health issues, but particularly, from nutrition stress, from environmental stress, from trauma. Trauma is huge. And then you have the drug available to you. So were many of those patients for your client, for the ones that you were talking about that were in the buprenorphine clinic, I'm going to try to not use brands, but so many of those patients were probably had a lot of trauma also, which is what I see. But if you start with a little bit of genetic underpinnings, then you really do have this perfect storm, and it really is a storm for everybody involved, for parents, friends, family members, neighbors, community, crime. Oh, well, yeah. So let me just say that then when I treat, I like to think about removing all pieces of the puzzle, removing some of the stress, or overcoming some of the biological issues such as nutrition, and maybe augmenting some of the genetic stuff, not through CRISPR, but through just some other nutritional supplements and medicines, not yet. And then also reducing the availability of the drug.
Got it. And so when you say genetics, I know there's methylation pathways. There's the COMT. That's a very critical pathway to look at as well. What else are you looking at?
Well, opioid mu receptor genetics. So people can have a variant in the mu receptor that might make their opioids just bind differently and cause a little bit of a different boost. Same with all drugs, GABA receptors, which would make people perhaps prone to alcohol. Certainly like COMT, which is related to serotonin breakdown, other things related to serotonin and dopamine production, processing, recycling, and activation. So there are, in most of the genetic testings that's focused specifically on addiction, there are probably anywhere from 10 to 40 genes that are really singled out. I work with Intellex DNA, which is a very broad spectrum genetic testing, but also with some genomic testing, but also with some kind of tools for the practitioner to say, well, this pathway has some mutations, so we can augment this pathway with, berberine or another botanical, or maybe don't try to augment this pathway with this particular medicine because of this genetic trait.
Got it.
But Reagan, the MTHFR, the methylation pathway, and that was one of the pinnacle things for me, was learning back 15 years ago about MTHFR in particular, and how inextricably linked it is to, I would say, 95% of my patients with addiction have a variant or two. And those that I can overcome that with a proper activated folate, they have a profound response to that, and that alone. Addiction is, I'm sorry to interrupt it, I can talk about this forever. Addiction is related to a dopamine spike. So when someone takes a thing and they have a response to it, they get a higher spike than someone that doesn't have the addictive qualities, the addictive underpinnings, the addictive response. And so if you're always low dopamine because of methylation, then when you take a drug, you're going to be more prone to get this, wow, where have you been all my life? And then you're going to do it again. Yeah, exactly. So you want to do it again. And so overcoming that and really we call it kind of hedonic tone or dopamine tone, which is not as incredibly scientific, but it's basically having the right amount of dopamine in the right places consistently and steadily, as opposed to a low amount and then a high, and then you get on this roller coaster.
Yeah, that's when people make some pretty irrational decisions. And I find with addiction, it's, we can help a patient, get off alcohol, for example, but then it almost gets replaced with another addiction, whether it's work addiction, pornography, gambling, marijuana. And so what have you learned in that pattern of addiction? I mean, it sounds like working with the Intellex DNA, I think that's great. Dr. de Blasio was the one that introduced us.
That's right.
She's phenomenal, and she's been on the show here, and a great partner with Go Wellness. But what are some of the things that you're doing to kind of shortcut that process, where a person goes from one addiction to the next, and maybe one's less destructive than another to their community and their family, but holy cow, to themselves is just as deadly.
It really can be. And I mean, not to knock exercise or running, but I've had a couple of patients that have gone from whole, they're really high energy people. They were using high amounts of cocaine and opiates, and the opiates give some people, I don't know about you, but when I took an opiate for my wisdom teeth removal 20-something years ago, it knocked me out and I felt like crap. And so I didn't go back to it. But when someone takes it and it makes it, like I said, this wow, this heck yeah, this is really the mind blowing, they're going to go back to it. And this one person I'm thinking of, she's cocaine, opiate addiction in her past, and was using them to be a super mom and, take care of all these kids and do all these things. And then she got off of those through my help, and she found exercise, which is great. She was a runner in high school. And then she started running essentially the equivalent of 3 marathons a week, which is just not okay and she works closely with the acupuncturist at my office. And so, he was also coaching her to kind of cut back. And so what we have to do is make it so that that people have, just like in other mental health issues, particularly let's say bipolar, where you have these really high ups and these really far downs. We want to like split the difference. We want to find the middle ground and make it pretty consistent, and without seeking that reward. The reward seeking is what people call cross addictions. It's really just addiction. It's just that it's manifesting in one way or another. And so I just like to, I'm going to plug medication for this because it's terribly important for folks, especially if for opioid use disorder. If they've had that opioid receptor covered by a drug for a long time, or they've been craving and seeking it for a long time, I'm going to have them. I always say I don't want someone to have an empty opioid receptor and be my patient for at least a period of time, because I worry that they're always going to crave that opiate. And an opiate, of course, with fentanyl introduction in our world, and you know how many overdoses there are when people come off of medicine or come out of treatment. I want to have that opiate receptor covered. So I'm going to use either a full agonist, which I don't prescribe methadone, but I'm fine with my patients taking it if that works for them. A partial agonist, meaning a part blocker, part agonist, which is buprenorphine, that's like Suboxone and Zubsolv and Bunavail. And there's actually a monthly injection. And there's even an implant coming out that will be like every couple of months. Or the opioid blocker, which actually blocks the opioid receptor, naltrexone.
Yeah.
That comes in the, and we use, I mean, in integrative medicine and integrative psychiatry, use naltrexone in the low dose form, compounded for tons and tons of things, from pain. What else do you use it for, Reagan?
Use it for like Hashimoto's patients, autoimmunity. It's phenomenal. The low dose naltrexone is great. Yeah,
it's great. And so, but we use it as an opioid blocker too. And so if you're like modulating metabolism the way that you are with naltrexone, and also boosting immunity, it also is very useful for opioid cravings and food cravings. It's actually indicated at the FDA approved dosing. It's indicated for binge eating disorder in conjunction with another medicine. So interesting stuff. So I just need to modulate everything so that they stay kind of in this middle ground without having the desire and craving for those far, far ups, because that's what that cross addiction is.
Totally. And have you done any work with metenkephalon, the peptide? Helps with opiate growth factors?
Yeah, so I've read about it and I have it on some of my talks, but I have never used it yet. Different states have different allowability for peptide usage.
Sure.
And I'm in Louisiana. And
you're in Louisiana. Darn it.
So yeah, so I personally haven't, but some of my colleagues have, and absolutely, it's fantastic. It has really exciting results, and and not just for addiction, right? Like for loads of other nootropic kind of modulations, you know?
Yep. Yeah. Boosting the brain, cognitive function is massive. And especially, you know, if you're using the LDN, you might find it very fascinating. We actually use LDN with Selenk for some of our, okay. So yeah, you're familiar with that strategy. Yeah, that's exciting. So with one of our guests, it's Dr. Santucci. He said, do you use neurofeedback to retrain brainwaves in addiction?
Absolutely. We use, there are actually some great neurofeedback take-home rentable devices because none of my therapists in my office actually do it right now. And also the live neurofeedback group that I used to refer to, they haven't been able to take any clients, but definitely in some of the inpatient settings, they start with some neurofeedback there, and then they do some rentable platforms. But yeah, absolutely. I think that's a great tool. I love it.
And you know, what's some of the patient cases that you've helped, and you know, maybe you could share with us what it's like when you actually get the result that you're after in your program.
You know, and that's the thing, like when addiction is so easy to treat. Mm-hmm. It's not easy because they're complicated cases, but if you have a tolerance for it, it's so gratifying and inspiring because you change lives, not just individuals, but like I said, family members, community, public health, criminal health. So you really make a dent. I have someone who is an attorney, and and I've been seeing him for about 12 years. He was in law school, and was going through, he was a pro tennis player, not pro, semi-pro tennis player before that, and had an injury. And so already you can hear some like high achievement, right? So overachievers have some prone underpinnings to likelihood or possibility of addiction, depending on what pathway they take. So he's an overachiever. Tennis injury, began, just like you said, kind of opiate pain pills as prescribed, began on those about 15, 20 years ago, and then ended up taking them consistently. When the prescriptions ran out, moved to street opiates. Thank God, not now, because most street opiates have fentanyl in them, and he probably wouldn't make it. But the street opiate pain pills back then did not. Anyway, and then started injecting them, because what happens is, like, as you neuroadapt, you basically like dull down your ability to get that reward. And so then you seek a higher dose, but also maybe a different route. So injecting, giving a much higher stimulation, a much higher spike. Anyway, so I got him in an intensive outpatient program about 12 years ago. And he was in law school and really just kind of pushing through, and went through an 8-week program there, and then started seeing me as an outpatient. We've got him on buprenorphine. He started seeing acupuncture for his injuries and for his pain, started exercising again, made it through law school, now is a successful attorney with 2 kids, successfully married, 2 kids, and happy, and seeking things like breath work. And we're doing a breath workshop, and he's going to be kind of my assistant. So he uses, for his anxiety, he was also used to take benzodiazepines, which is of course risky with any opiate. Mm-hmm. And so now he uses a lavender product called Lavella Silaxin, which I love. And he uses a lot of supplements, magnesium especially, and alpha stimulators, one of the therapeutics that I like for anxiety. There's loads of other cranial electrostimulators, but I like that one. Just that's the one that I happen to have attached to. So that is a little bit about a successful case. And he sleeps, like I always ask about at every appointment. I see him monthly. Actually, I see him today. I ask at every appointment, what about your mood, your mind, your anxiety, your cravings, and your sleep? And so for mental health, when people no longer have these like spinning off the rails, or if they're bipolar and they don't have these like crazy high ups any longer or downs, then I ask about those 5 elements. And so sleep was always a big problem for him, as it is for many, many patients with any sort of addictive, any toxic addition to their life, physical toxins such as opiates. It's basically causing brain damage for a long time. And so the alpha stim has helped tremendously for sleep. We used to have him on medications for sleep, and now the only thing he's taken medication wise is buprenorphine. Yeah. And that's it. And everything else is acupuncture, nootropics, electrostimulation, and lifestyle. That's awesome. What I want. Yeah.
What are some of the nootropics that you find work the best for your patients?
I use I use a lot of lithium orotate. So the trace mineral lithium, and pretty much I would say half of my patients take that for various reasons, mood in particular. And this, we just had a hurricane here in New Orleans, and everyone's having PTSD and real prickly. And so irritability and road rage are high. So I'm using a lot of the Lavella and lithium orotate. I use NAD a lot, and I use an oral prescribed form of NAD I'm sure the audience knows as much about NAD as I do, but just to clarify, nicotinamide adenine dinucleotide, and I use that it's an oxidative damage repair molecule, and I use it as a melt, or some people do a subcutaneous self-directed dosing. I use citocoline and berberine and some other some of the like mushroom myco combined supplements. I'm trying to think of what else is big on my list. That's a big amount of my kind of nootropics for brain health, and I look forward to peptides. Not there yet. And maybe if I'm in another state, I'll be able to use those actively.
Yeah, we have a doctor there. He's a client in my peptide program, and he has to get him shipped to Mississippi because he's right there. So it's interesting. But yeah, certain states have different laws. So if you kind of look at your overall passion for helping people with addiction, how did you go down this course in the first place?
It's interesting. I mean, I was in the Bay Area, and I was living a kind of Bay Area early 20-something lifestyle, and a lot of my friends were fringe, and I was living in a warehouse, and a lot of music around, and I was seeing people overdose, or seeing people use the same drug. And when pre-Burning Man was over at like Ocean Beach, seeing people get just wildly messed up taking the same drug as others that were not getting messed up, and some people, like everyone sitting around together, and one person needing to go to the hospital, and everyone else like thinking that it was a problem with the drug, when in fact it was probably a problem with the interaction of the drug in the person. And so I kept that in the back of my head, found that to be a very interesting part of my genetic development and interest. And so when I was working in genetics, we were talking about dopamine receptors and talking about opiate receptors. And so that was something that intrigued me. And so when I was in medical school at University of Southern California, I ended up working on a project on breast cancer, but there was also a side project that was going on, and it was about dopamine receptors and dopamine tone related to addiction. And so it just kind of happened that, I didn't seek it out necessarily, but I found myself in places where that was just a question. And, why does one person, I think I even have a chapter on this, why does one person, I mean, I know I have a chapter on this, I think it's titled, why does one person get addicted and another does not? It really is that there's just so many factors that go into it, like why, twin studies will show environment it will lead to one thing versus another. And then there's a lot of genetics that are kind of predestined for folks to have one disease or another. Anyway, so during psychiatry residency, we had Hurricane Katrina. And so I was at LSU, and after LSU, I was kind of shipped off to central Louisiana, somewhere coming from a California girl. I really didn't think I was going to live in the sticks in central Louisiana. It's lovely, by the way. I had a great time, but I was there for 15 months, and there was a treatment program. We were just kind of spread all over. There was a treatment program that I ended up volunteering at, and just because it was up the street, I needed to learn stuff. And the director, who's now a friend, the director of the American Society of Addiction Medicine, happened to come in for 2 weeks and basically do a big training for them. And so then I became like a young, seriously knowledgeable expert on the field of addiction. And then that's what has kind of stuck. So here I am.
Wow. Well, I'm so glad you're in this field, because now more than ever, I mean, I read a statistic about 6 months ago that showed benzodiazepine prescriptions are up 35% since the COVID pandemic. Opiate abuse, I don't remember how much that's up, but But recovery and addiction is such a big thing. And now that we have kids just glued to smartphones,
Oh my God.
there's so many new addictions that are showing up that, I am frankly worried about the next generation because of
Me,
that.
yeah, me too. It really is quite, I mean, what's available and what is shaping our brains is just scary. And yeah, not only do we have like a massive amounts of opiates on the street now, so it's less being prescribed because that's we pulled back on that. Loads of benzos being prescribed though, especially with the pandemic, like you said. But meth is next. So we're looking at a meth epidemic coming down the pipeline, no pun intended, and it will be nasty. And, meth, street meth is going to have, well, there's not non-street meth, but people do crush their Adderall and use it. But street meth is going to have a lot of fentanyl in it. So that's, we're concerned about that as well. There was a thing I went to with the DEA a couple of weeks ago, and that's what they were talking about.
Man, and maybe you could talk about fentanyl. I believe it's about 50 times more powerful than morphine, but you'd probably know more about it than I do.
Yeah, it's 50 to 100 times more powerful than morphine. And then there's other analogs that are things like carfentanil and lots of other analogs. Now, what's interesting is, for those of us that are prescribers that have the possibility of prescribing fentanyl in the operating room or in the emergency room, there are fentanyl patches. We use IV or IM fentanyl, depending on the case, for specific needs in surgery. And that is fine. The fentanyl we're talking about is not US manufactured fentanyl. The fentanyl that's on the street is coming from usually somewhere in Asia or somewhere south of the border, just like most of the other drugs are. And it's unpredictable. So we're taught in medicine that fentanyl, as we use it in the operating room, has a short half-life. So it comes and goes really quickly. But what we're learning from street use is that it has a really long staying power. And so even though people get like really high and then drop off, as far as like, if you're using a medicine if you're using Narcan to bring it back to life, you might need several doses, because it not only is it strong, it's actually stays on the receptors longer. And so it's very scary and very concerning. And unfortunately, I feel like, although I love helping folks that want to get well, and I have these really amazing outcomes and just things that are inspiring and gratifying, the disease of addiction, or the community health disease of addiction, is like a game of whack-a-mole, because we just, we get something, we get a medicine, we get more access to treatment, we have, more treatment, more providers that are interested in treatment, we get treatment in community health centers, and then another drug or another, problem comes up, like you said, like being glued to the phone, or, another drug comes on the market that is going to be 10 times more,
Yeah. It's an interesting time. And so if you kind of went upstream, at the very beginning of the show, you said it's genetics and stress are two of the big contributing factors. Not much we can do about our genetics, but maybe there's ways you could support those pathways. So do you recommend everyone just gets their genetic tests done, or do you have a certain protocol that people could do to keep those variants stable?
Yeah, so the most tangible thing really is that if there's one thing, it's really about dopamine production, and that would be related to like the MTHFR genetic pathway. So that's great. And then you can really just approach, upregulating methylation, or it might not need to be upregulated, it might need to be stabilized. And so stabilizing the methylation is a great tool. And then when we're talking about other genes, let's say the dopamine receptor, you can do some other augmenting for each gene, and like Intellex has some great tools to do that. But just things like you were talking about, like some of the peptides, some of the nootropics, but also lifestyle and diet. I think the DRD2 pathway, if you have any mutations there, you want to consume a lot of butyrates like asparagus and garlic and leeks and stuff like that. And make sure your vitamin D is at a nice and high dose. Tyrosine hydroxylase is another one, and things like nutrients such as zinc and magnesium and omega-3s are useful for upregulating those pathways if they're downregulated because of mutations. So there's loads of stuff like that. But honestly, for someone that doesn't want to go the path or can't afford the path, because that there is a cost prohibition of some of these tools, I do a very thorough clinical interview, and that gives me basically my patients that have gone down the genetic pathway that I've seen for a long time. Once they do the genetics, they're like, oh, you were right. Oh, you were right. Oh, this is, you knew it, you called it. That's why I'm on this medicine. And that's what this particular mutation suggests I should be on this medicine, so if you're a savvy clinician, you can kind of take some leaps to understand what the clinical symptoms and what the family history and what the underpinnings of the background are, and which is what we've done in the art of medicine forever, right?
Yep.
And so I tend to, based on symptoms, use a lot of zinc and magnesium, and maybe without doing any micronutrient testing, just a large nutrient booster, something that has, for mental health, I use a lot of Hardy daily essential nutrients, for example, because it just balances the system pretty well. I think there's so much out there, and just getting a healthy lifestyle is the start. But you can't have a healthy lifestyle if all you're doing is, spending all day, every day thinking about trying to get a drug.
So challenging. Yeah, it's trying to get that next dopamine hit. And so if you look at some of the things that work best as far as lifestyle goes, I know you're big into breathing and meditation, exercise is key. What are some of the ways, and once again, I really appreciate your insights on this, is so powerful, but what are some things people can do if they feel like they're kind of at that gateway of falling into an addiction? How can they get help, and what's some things they can do right now before they fall down that slippery slope? And maybe that's even they're going to get surgery and they're concerned about getting that opiate prescription.
Yeah, I mean, I have to say, many friends have tried an opiate for that wisdom tooth thing or something in high school, and they were like, oh, I need to never try these again because that's too good for me. Right. So yeah, so it's true. So if you're going, if you have had a breakup and you've had a traumatic physical or mental experience, and then you're going into a risky situation such as a surgery or some sort of thing that will require an opioid, for example, or your anxiety is so high and you're starting to take benzodiazepines on a daily basis, then the whole gamut that we're talking about, making sure your dopamine tone is strong and making sure that you have a limited, so making sure that you have you don't have the cravings for spikes that will then cause the fall. Adding things for pain management, acupuncture, I think, is the number one, because acupuncture also not only does it help with the musculoskeletal, as you know, but it can really help with epigenetics. And so you take away some of the metabolic and physical stressors by using acupuncture, and it can change epigenetics, which can help people be more resilient. One of the things is making sure that you are not isolated. If you're isolated and you're alone, here we are in a pandemic where we've been almost 2 years of social isolation, which is, I wish that it was called physical distancing, because we shouldn't be socially distanced. We should be physically distanced for safety. But regardless, making sure you have someone that is on your side. And if you are concerned that you might be at risk, that for taking opiates, for example, then you make sure someone has you walking through when you take the medicine. Maybe someone else holds the medicine for you. But isolation is the opposite of isolation is such a contributor to addiction. And so, we need that social connectedness.
Mm-hmm. Yeah, I mean, and even physical distancing, I mean, there's a loss of oxytocin that comes from shaking hands and hugging and being close to people we love. And so I think, it would be hard to prove that isn't a big contributor to the increase in addiction right now.
Completely.
Of some of the choices we've made. And then we go back to the question, well, was the cure worse than the disease? And so I guess we don't really know. But you're out there working with these patients every single day. And so sounds like some of the advice, I mean, obviously big fans of acupuncture. Yesterday I had a patient I hadn't seen in like 5 years, and she's like, I forgot how good acupuncture makes me feel. It's just such a cool medicine, and it's been around for at least 3,000 years. I mean, just phenomenal. So do you practice acupuncture yourself, or do you have acupuncturists?
I have an acupuncturist that I have 3 acupuncturists that I work closely with that I refer to. And one of them is in my building, and we share a business, but we're not like in the same business. And then when I work at the intensive outpatient programmings, we have a couple of our staff are trained in Nada technique. So just those 4 points of the ear acupuncture, it really is phenomenal for both addiction and for just general wellness. So I actually had a seed in my ear until this morning. So just, for just a little, brightening. And I have used, one of the categories of patient that I work with is pregnant women with addiction. And so I have an OB-GYN that has worked with us, and we get people that are opioid users that are about to have a baby, and we need to affect the baby's health as well, And so using acupuncture, we use the Nada technique pretty frequently with the pregnant group. And then of course, medication necessarily. And then a lot of the patients that I see in this category tend to not have much funding. So we don't do a lot of the bells and whistles, but I do get them onto methylation protocol, as well as some basic supplements for health from, zinc and magnesium in particular.
That's great. Yeah, that is transformative. Where do you see the biggest pitfalls are in the way we handle addictions in conventional medicine?
Straight up stigma. We've got to talk about stigma. I slip into it. I try to not say the word addict when I'm describing a patient. So I'm not like trying to give them a heavy name. But someone with addiction, someone with opioid use disorder, just like trying to say enslaved people instead of the slaves, right? So it has that same weight when you're speaking about someone. So we really have to wrap our heads around how the medical community and the general community has created or retained this stigma. And the language of, like, even my staff at certain places, I'll have to, we need to not talk about a dirty drug screen or the patient is dirty, or the patient is clean. When the patient's clean, that's awesome. Great. That's great. They've washed, they don't have drugs in their system, but the opposite of clean is dirty. Right. And so we really want to try and be more medicalized about it, because one of the big factors that has contributed is the, many, many, many years of non-medicalizing this disease. And when in fact it is a disease, it's a disease that has some sucky behavioral outcomes. And that's what has been characterized as, that addict or that bad person doing bad things, but when we can talk about it as a disease like cancer, then we can talk about the medicine treating the disease, or the treatment treating the disease, or the treatment failing the disease, not the patient failing the disease, not the patient failing the treatment.
Yeah.
Just like everything else.
I like that.
And you know, we had to do that with diabetes, you know, the diabetic, because it was such a shameful thing for folks 30, 40 years ago to speak about diabetes, cancer, certainly mental health. We still struggle with, you know, the schizophrenic and, you know, the bipolar patient versus the patient with mood swings, you know. So really trying to relabel or unlabel so that we can kind of make this known as a medical disease. I want to mention a study that I really thought was amazing. Speaking about stigma, it was a survey of just a bunch of non-therapists, non-treaters. I don't remember how they found the audience, but anyway, they just identified 2 different patients and asked some questions about the potential patients. And one of the patients was referred to as a substance abuser, and the other person was referred to as having a substance use disorder. And the one that was the substance abuser was perceived wholly by the whole crowd to be less likely to benefit from treatment, more likely to benefit from punishment, more likely to be socially threatening. So even the word abuse, that's like, you know, a domestic abuser. Let's punish someone that's a domestic abuser, a substance abuser. It's just, you know, it's a trigger in your mind. So anyway.
That's powerful because, you know, so many people, you know, of course, have addicts in their life. Maybe it's a spouse, maybe it's a son, a daughter, a mother, a father. And so your whole life, you're dealing with this almost, you know, you just feel completely, you know, you're a second class citizen to the addiction in most cases. So it's hard not to put a stigma on addicts, you know. I think it's a radical thing. So there's a guy named Joe Polish. Have you heard of him in Genius Network?
Yeah. Not terribly. No, I have not.
I need to connect you to, because he's got the Artists for Recovery Foundation, the Genius Recovery, and so he raises a lot of money for people in recovery. But he says that addiction, the opposite of addiction, is connection, and
Correct.
so it's people having a loss of connection in their life, and with addiction, you're running down the wrong pathway. You're climbing the wrong tree to get the connection.
Right. You misaligned the connection. Your brain, you know, you're like, oh, I'm eating an apple, I'm hanging out with friends, those are all like here for connection and for salience and enjoyment. And then you get something that goes here, and the brain's just like, nope, I don't need any of the other stuff. Don't need the apple or nutrients. I don't need the friends. I don't need, you know, because it's going for that one reward. So we've really got to, and that's definitely part of the elements of treatment that's necessary is getting out of isolation, getting those deep connections.
And so you, in that study that you referenced, they called it a substance
abuser versus a substance use disorder.
Substance use disorder. Actually, from a medical provider perspective, placebo is such a powerful thing in medicine, and the way that the doctor perceives the patient is going to predict the outcome. And so, you know, even from that, you know, being a substance abuser, you're already set up to fail, which is probably why people end up in recovery so frequently. They go in, they're clean, as you say, and for you know, the 3 months that they're in recovery, and then they bounce out, and so it's crazy. So this has been exciting. People can get your book how?
So I have it on Amazon. It's a little confusing because there's several books called Hooked on Amazon. It looks like Chanel did put it in the link here. And so it's a 2021 release of Hooked, which is a concise guide to the underlying mechanics of addiction and treatments for patients, families, and providers.
Awesome.
It's also on my website, podestawellness.com.
Podesta Wellness. So we'll post those in the show notes. I know you've got to run to your next patient, so we're going to let you go. And then I've got a couple announcements to make for everybody. So stay stay on here. But Dr. Podesta, thank you so much. Appreciate all the great work you're doing. The love and compassion that you provide is just incredibly inspiring.
Thank you. So great to talk. What a great morning. Enjoy your smoothie, whoever's getting that one. And I need one now too. And thanks for everything. And thanks for everything that y'all do.
You got it. Take care.
Thanks
Take
for
care.
joining us.
So, Kate,
All
that
right.
was we covered a lot of great territory there with Dr. Podesta, and I think everybody on this, if you can let's just take a minute and just summarize. I mean, what were some of your takeaways on that, Kate? I mean, my biggest takeaway was the stigma, and there's been a lot of conversations. We need to bring intelligent conversation around this addiction problem that we have. Anything else that you got out of that?
No, I think that's probably the biggest thing that I did get out of that is just bringing it to light, because sometimes it's kind of a a dark or maybe a topic we avoid, and it's just not yeah
Not addressed
it's just not
appropriately.
openly discussed, and I think just like bringing it to light is really important.
Yeah. Yeah. So, hopefully you guys enjoyed that. We have our 6-week brain reset. And for those of you who are looking to, maybe you're at that gateway and you feel like, man, I feel like I'm slipping again. Make sure you jump into our 6-week brain reset. And that's in our health accelerator group. And so let's jump in that, because resetting your dopamine, we give you challenges on ways to reset the dopamine. And Kate probably remembers that one. And then we have our serotonin reset, oxytocin, acetylcholine. And then we have just the overall ways of boosting brain-derived nootropic factors, ways of boosting memory. So let's get our brain super healthy. And then the people who do struggle with the substance use disorder, let's reach out to them. Maybe share the book from Dr. Podesta and get them some help. Get them into the clinic for acupuncture. That'd be another great thing you can do. So really appreciate all you being part of this community. And for those of you who also are looking for a great way to boost your brain, get some Inner Genius on the smartmedicine.com. You won't regret it. Kate's got his there. Awesome.
I'm taking mine right now because I haven't taken it yet this morning, and it showed this morning as the blender started buzzing. I
was
couldn't
distraction.
function.
Yep. He's going to be on it the rest of the day now, folks.
Yeah.
All right.
Thank you so much, everybody, for joining us. We'll be back same time, same place next week. And really appreciate you guys. I know there's some problems with our reminders, so we'll be sending out another email just with an updated registration link, so everybody gets their weekly reminders on this as well. So we had quite a few phone calls, so sorry if you missed the show or you came in late, but thanks for joining us, and we'll see you guys next week. See you, everybody.
Bye-bye.